Resistant hypertension remains one of the biggest challenges in clinical practice, but a new molecule, Baxdrostat, may change the conversation. Let's see how it works and what the research says about it. What is Baxdrostat? Baxdrostat is an investigational oral medication that belongs to a new class of antihypertensive agents known as aldosterone synthesis inhibitors. It has been studied in patients with hard-to-control hypertension, who often have aldosterone dysregulation. It is not yet approved, but early results are promising. What research says about Baxdrostat, a clinical trial evidence. A Phase 3, multinational, double-blind, randomized, placebo-controlled trial was conducted, including 794 adults with hard-to-control hypertension. In this trial, hard-to-control hypertension was defined as uncontrolled hypertension and resistant hypertension. Uncontrolled hypertension was a seated systolic blood pressure between 140 and 170 mm of mercury despite treatment with maximally tolerated 2 antihypertensive medications. And resistant hypertension was defined as a seated systolic blood pressure between 140 and 170 mm of mercury despite treatment with maximally tolerated 3 or more antihypertensive medications. Trial participants. 794 adults were included in this trial who were divided into 3 groups to evaluate the efficacy and safety of Baxdrostat. Participants in Group 1 received Baxdrostat 1 mg once daily, while participants in Group 2 received Baxdrostat 2 mg once daily. Group 3 served as the placebo control group. Trial results. The primary efficacy endpoint was change in a seated systolic blood pressure from baseline to week 12. At 12 weeks, seated systolic blood pressure decreased by 14.5 mm of mercury in participants who received 1 mg of Baxdrostat, and by 15.7 mm of mercury in participants who received 2 mg of Baxdrostat as compared with 5.8 mm of mercury in the placebo group. Baxdrostat reduced seated systolic blood pressure by 8.7 to 9.8 mm of mercury compared with placebo. Difference between each dose of Baxdrostat and placebo was clinically significant. With respect to safety, the potassium level of 6 mmol per liter was reported in 2.3% of participants in the 1 mg Baxdrostat group, and 3% of participants in the 2 mg group as compared with 0.4% of those in the placebo group. Other adverse effects were hyponatremia, hypotension, muscle spasms, and dizziness. Most of these adverse events were mild. Conclusion. In patients with uncontrolled or resistant hypertension, adding Baxdrostat to their existing therapy significantly lowered seated systolic blood pressure at 12 weeks compared with placebo. Both the 1 mg and 2 mg doses were effective, with the 2 mg dose showing the greatest reduction. Baxdrostat was generally well tolerated, with only a small percentage of patients experiencing severe hyperkalemia. These results highlight Baxdrostat as a promising investigational treatment that may offer a new approach for managing patients whose blood pressure is difficult to control with current medications. Thank you for watching. If you found this useful, consider subscribing to my channel for more clinical updates and practical tips.